This is the step-by-step instructions for using the Benlysta pre-filled pen, belimumab, for once-weekly subcutaneous administration. Read the instructions for use and the medication guide that come with your pen. Follow the instructions on how to use the pen the right way. Failure to follow the instructions may affect proper function of the pen. You should also receive training on how to use the pen. The pen is for use under the skin only, also known as subcutaneous use. Please take note of the following important storage information for the Benlysta pre-filled pen. Keep refrigerated until 30 minutes before use. Keep in the carton to protect from light. Keep out of the reach of children. Do not freeze. Do not use if left out at room temperature for more than 12 hours. Please take note of the following important warnings. The Benlysta pre-filled pen should be used only once and then discarded. Do not share your pen with another person. Do not shake. Do not use if dropped onto a hard surface. Do not remove the ring cap until just before the injection. Please take note of the pen parts so that you're familiar with them throughout this video and while you're giving yourself the injection. The pen contains an inspection window and a gray stopper, which you will need to observe during the injection. Later, when it is time to remove the ring cap, you will see a gold needle guard, but the needle is not visible. The pen also has an expiration date. Do not use the pen if the expiration date has passed. To perform your injection, you will need a pen. You will also need an alcohol swab, a gauze pad or cotton ball, and an empty container with a tight-fitting lid for pen disposal. These materials are not included with the pen, so make sure you have them on hand before you inject. Step 1. Gather and check supplies. Remove one sealed tray containing a Benlysta pre-filled pen from the refrigerator. Find a comfortable, well-lit and clean surface and place the pen, alcohol swab, gauze pad or cotton ball, and empty container within reach. Do not perform the injection if you do not have all the supplies shown here. Peel back the film of the tray and remove the pen. Check the expiration date on the pen. Do not use if the expiration date has passed. Step 2. Prepare and inspect the Benlysta pre-filled pen. Allow the pen to sit at room temperature for 30 minutes. Do not warm the pen in any other way. For example, do not warm in a microwave oven, hot water, or direct sunlight. Do not remove the ring cap during this step. After 30 minutes, look in the inspection window to check that the pen solution is colorless to slightly yellow in color. It is normal to see one or more air bubbles in the solution. Do not use if the solution looks cloudy, discolored, or has particles. Step 3. Choose and clean the injection site. Choose where to inject on your abdomen or thigh in the highlighted areas shown here. Avoid injecting into the same site each time and areas where the skin is tender, bruised, red, or hard. Do not inject within 5 centimeters, 2 inches of the navel, belly button. Next, wash your hands. With clean hands, clean the injection site by wiping it with an alcohol swab. Allow the skin to air dry. Do not touch this area again before giving the injection. Step 4. Prepare for the injection. Do not remove the ring cap until right before the injection. Remove the ring cap by pulling or twisting it off. The ring cap may be twisted off in either a clockwise or counterclockwise direction. Do not put the ring cap back onto the pen. Hold the pen comfortably so that you can view the inspection window. This is important so that you can confirm a complete dose. If needed, firm the injection site by pulling or stretching the skin. Position the pen straight over the injection site. Make sure the gold needle guard is flat on the skin. Step 5. Inject Benlysta pre-filled pen. Firmly press the pre-filled pen all the way down onto the injection site and hold it in place. This will insert the needle and start the injection. You may hear a first click at the start of the injection, and you will see the purple indicator start to move through the inspection window. Continue to hold the pen down until you see that the purple indicator has stopped moving. You may hear a second click a few seconds before the purple indicator stops moving. The injection may take up to 15 seconds to complete. When the injection is complete, lift the pen from the injection site. Step 6. Dispose and inspect. Dispose of the used pen and ring cap in an empty container with a tight-fitting lid. Do not put the ring cap back onto the pen. Ask your doctor or pharmacist for instructions on how to properly dispose of a used pen or filled container. Always keep the filled container out of the reach of children. Do not recycle or throw the used pen or filled container into household rubbish. There may be a small amount of blood at the injection site. If needed, press a cotton ball or gauze pad on the injection site. Do not rub the injection site.